Hello and welcome to Easy Learning with Dr. Salman. Next is the clinical features. Clinical features can be divided into based on the type and condition, the age and immunologic status of the host, and based on the clinical picture. First, the type and condition. It is divided into acute giardiasis and chronic giardiasis. First, the acute giardiasis. It develops after an incubation period of 1 to 14 days, an average of being 7 days, and usually lasts for 1 to 3 weeks. The symptoms include diarrhea, abdominal pain, bloating, nausea, and vomiting. Then the chronic giardiasis. The symptoms are recurrent. Malabsorption and debilitation may occur, and these may be due to failure to develop immunoglobulin A, that is IgA, against specific giardia antigen. Then, based on the age and immunologic status of the host, this can be further divided into symptomatic children, older patients, travelers diarrhea, and gallbladder infection. First, the symptomatic children. These present with watery diarrhea and may develop chronic diarrhea with malabsorption, and this malabsorption is specifically of fat, vitamin A, vitamin B12, folic acid, protein, sugars like xylose disaccharides, leading to weight loss and sprue-like syndrome. Then the older patients, they present with epigastric pain, low-grade fever, diarrhea, flatulence, and abdominal distension. The stools contain excess mucus and fat and are foul-smelling in odor without pus or blood. Next, the traveler's diarrhea. This occurs through contaminated water and is frequently seen in persons visiting endemic areas. Then, the gallbladder infection. Occasionally, giardia may colonize the gallbladder, producing biliary colic and jaundice. So, these are the clinical features. Then, based on the clinical picture, clinically the cases may be divided as: first, silent cases without any symptoms; second, intestinal, which include chronic enteritis, acute enterocolitis, and malabsorption syndrome; third is the general cases which present with fever, anemia, and allergic manifestations; and fourth is chronic cholecystopathy. So these are the clinical features of Giardia lamblia. Next is the laboratory diagnosis. The laboratory diagnosis is done as follows: first, the stool examination; second, entero test or the string test; third, serodiagnosis; and fourth, the molecular method. First, the stool examination. Giardiasis can be diagnosed by identification of cysts of Giardia lamblia in the formed stools and the trophozoites, and cysts of the parasite in diarrheal stools. The stool examination can be done macroscopically as well as microscopically. On macroscopic examination, fecal specimens containing Giardia lamblia may have an offensive odor, are pale colored and fatty, and float in water. On microscopic examination, cysts and trophozoites can be found in diarrheal stools by saline and iodine wet preparations. Often, multiple specimens need to be examined, and concentration techniques like formal ether or zinc acetate are used. In asymptomatic carriers, only the cysts are seen. Then the entero test or the string test. This is a useful method for obtaining duodenal specimen. A coiled thread inside a small weighted gelatin capsule is swallowed by the patient after attaching the free end of the thread in the cheek. The capsule passes through the stomach to the duodenum. After 2 hours, the thread is withdrawn, placed in saline, and is mechanically shaken. The centrifuged deposit of the saline is examined for giardia. The use of entero test is not recommended because of the very high cost of the test. Then the serodiagnosis. It includes antigen detection and antibody detection. Antigen detection, enzyme-linked immunosorbent assay, that is ELISA, then immunochromatographic strip tests, and indirect immunofluorescence IIF tests using monoclonal antibodies have been developed for detection of Giardia antigens in feces. The presence of antigen indicates active infection. The sensitivity of the test is 95% and specificity is 100% when compared to conventional microscopy. The test may be used for quantification of cysts and in epidemiological and control studies, but not for routine use. Then antibody detection, indirect immunofluorescence test and ELISA are used to detect antibodies against Giardia. Demonstration of antibodies is useful in the epidemiological and pathophysiological studies. These tests cannot differentiate between recent and past infection and lack sensitivity and specificity. And lastly, the molecular method. These are deoxyribonucleic acid DNA probes and polymerase chain reaction PCR. These have been used to demonstrate parasitic genome in the stool specimen. So this is about the laboratory diagnosis. Lastly, the prophylaxis. GIARDIasis can be prevented by the following measures. First, proper disposal of wastewater and feces. Second, practice of personal hygiene like hand washing before eating and proper disposal of diapers. Third, prevention of food and water contamination. Fourth, community chlorination of water is ineffective for activating cysts. Boiling of water and filtration by membrane filters are required. So this is all about the parasite Giardia lamblia. If you wish to see more of such videos, do comment below. And don't forget to like, share and subscribe to my channel. Also, press the bell icon for early notification of my new videos.